here. You can see now my PowerPoint presentation. I will do this way so that, hello, you can see me now, right?
Yes, yes. Yes,
All
doctor.
right. So I intentionally did not get the 130 because I know what you would actually feeling when you are going to have your first quiz. This is your first exams, right? In our university.
Yes, the
Next
first one.
next week you're going to have another one that will be mine. But anyway, so in connection with what you actually did experience this afternoon, including last night, most probably many of you or all of you could have encountered anxiety, isn't it? Anxiety, your anxiety is on the roof, right? Did you do that? Did you encounter anxiety?
Yes, we couldn't sleep.
You couldn't sleep, you couldn't eat, and so on and so forth. Basically, this is actually human reaction. This is very normal. When you suffer anxiety, that means to say you're normal. Anxiety is actually happening every day. Do you understand what I mean? Anxiety comes to us every day. Our patients may actually suffer anxiety also. But the thing is that how are we going to do and what are we doing? What are we going to do in case anxiety comes in? Right now, you're attending my class. That means to say you got over with your anxiety, right? You were able to attend the examination, so you got over with your anxiety. But there are people who could not get over their anxiety to the extent that their functionality could have been affected. They could not eat anymore, they could not sleep, and in its entirety, their lifestyle could actually be affected. So it really would be a very big problem, especially when we are taking care of patient with severe anxiety and at the same time with functionality problem. If the anxiety is sustained over a longer period of time, it may become a disorder. So this is the thing that we are going to look into. Now, remember, when you're going to take care of patients who are in the hospital, as I mentioned to you, the first thing that they would actually have to encounter would be anxiety because they would be away from their environment, from their family members. So let us try to look into the different types of anxiety and what could have caused anxiety. But before we go to that one, let us try to look into some of the definitions that we would be using in discussing anxiety. No, how are we going to face people with anxiety? So let us try to look at some of the definitions that we would be using. So number one, we would start with acute stress disorder. This would always cause some anxieties that we would encounter. This is a disorder characterized by a high level of anxiety immediately after a traumatic event. This is immediately after a traumatic event. No, agoraphobia is another. No, this actually is characterized by fear, anxiety, or avoidance of places or situations from which escape may be difficult or where help may be not be available. That means to say it's an open space. You're alone, and it's an open space. Then anxiety also is another term that we will be using a lot since we will be discussing problems with anxiety, patients with problems on anxiety. So anxiety is usually an unpleasant tension, apprehension, and uneasiness, or a diffuse feeling of dread or unexplained discomfort. This is usually a feeling of dread that would make it uncomfortable to all of us, no? Accompanied by some normally physiological reaction, psychological reaction, and to top it all, behavioral symptoms, no? Although anxiety may serve as a warning signal of something that's threatening us. So we look into that, we'll be using this a lot. And we have also the next one. Okay. We have anxiety disorder due to general medication. When we give medicine, these are some of the things that we will encounter. No, anxiety characterized by prominent symptoms directly related to the physiological consequences of a general condition, like in the case of hyperthyroidism, hypothyroidism, hypoglycemia, chronic obstructive pulmonary disease, or the COPD. No, among all its people, particularly those who are smoking. Then fear is another term that we'll be using a lot. No, fear is a reaction to a specific danger. Anxiety, unknown, but fear, you know already that there is a specific danger, so react. Now, somewhat this is somewhat fear will always help us to prepare. This will always be negative, and at the same time, it has also positive effect to some degree. No, then we have also the GED or the GAD, the general anxiety disorder. This is a disorder characterized by at least 6 months of persistent and excessive anxiety and worry. So you are worrying a lot, no? Then we have the OCD also. This is recurrent, chronic. Once in a while it comes, no? Is recurrent thoughts or ideas, that's obsessions, that an individual is unable to put out of his or her mind in actions that an individual is unable to refrain from performing, that is actually compulsions, no? That's OCD. This is pertaining to our ritualistic behavior, right? Then another term that we'll be encountering will be panic attack. What is the meaning of this? No, a discrete, sudden, unpredictable, intense episode of severe anxiety characterized by personality disorganization. This is always classified as the fourth level of anxiety on top of mild, moderate, and severe anxiety. So panic attack is the highest level of anxiety that you could actually have. There would always be a physiological reaction, among others. There is a feeling of impending doom, helplessness, or being trapped. And then another very important term that we'll be having is PTSD, or what we call as post-traumatic stress disorder. What's this? Now, this is anxiety and stress symptoms that occur after a massive traumatic event, like in the case of witnessing someone who was killed, or witnessing an accident, or just merely you are in a dreaded situation, like in the case of battle or war. You are there trying to kill people or to be killed also if you are a soldier, no? Independing your sovereignty. Now, this will always include the feeling that the event is recurring. It may come, or it will be lasting for weeks, months, or even years. And sometimes you need treatment if you do have PTSD, because your functionality could actually be affected as such. Okay? So there is also post-traumatic stress response. What do we have here? No, this is a persistent disorganizing and distressing reaction to a very catastrophic event that affects your personal, emotional, cognitive, and behavioral dimensions. And at the same time, relationships and extends beyond the time of the immediate crisis. No, this is the response that we may have in case we encountered or we witness an event that may not last long, that may be short-lived. Then there is also SAD, social anxiety disorder. This is with intense, persistent fear of social situations. That's why you would always want to be alone, just because of that, no? Or phobia. We have agoraphobia already. This is irrational fear of something, no? That causes us to react abnormally, no? Then there is also another word that we will be encountering. This is substance-induced anxiety disorder, right? This is a disorder characterized by prominent anxiety symptoms directly related to physiological consequences of drug abuse, yeah, and other uh, drug enhancement medications, toxins, or toxin exposure, and other substances, right? That's substance-induced anxiety disorder. So let us try to see, no? Anxiety is normally, whether we like it or not, comes to us. It is normally coming to us every day. This is always considered as our primary emotion, from which many other emotions or responses as anger, guilt, shame, and grief are actually generated. No, if we will review our class in psychology, uh, where actually that would be considered as our first day of class. Now, when we discuss about this, um, there would always be a battle or a war that is going on with us, and this is always generated. No, our personality would always be made up of three structures according to Sigmund Freud: id, ego, and superego. So id and superego are always happening inside of us. So the battle would always result into anxiety. That is the resultant emotional response that you may actually have. That's why every single person, you encounter anxiety every day, but the way we react will be different. So anxiety for some other people would be normal. Anxiety for other people would be abnormal. You have similar experiences, but your reactions would be different. And sometimes the reaction would always be considered as, let's say, unpleasant and always negative. Although anxiety could always be negative and could also be positive in a way, because it will help us prepare for an impending event. If we would feel that there is a doom that is actually waiting for us near in the near future, then we will prepare. That is how and what your anxiety can do for you. Now, the term anxiety brings up images of someone pacing and wringing his or her hands with pounding heart. And with rapid breathing, that's usually our physiological reactions, no? Especially before taking the important examinations in school. That's why this afternoon, when Dr. Ramya called me, that telling me that we would have examination, I told her, okay, if she told me that you would take 1:30 if you want. I said no, because the student would not concentrate, because the students would always feel anxious. If you are anxious, you could not actually focus on doing what you are supposed to be doing. That means you would not concentrate. If I took my class at 1:30, perhaps you would not be listening to me. So my class would be useless also. So that the meaning of that one, no? So it is the case, no? There are so many cases that can actually bring us anxiety. Like, for instance, biopsy was done to you. So when the announcement of the result is already there, you feel so anxious already. What would be the result? Am I going to die tomorrow, or I'm going to live? Or the result is normal, or the result is normal? So sometimes you already are anticipating what would be the result of the things that would happen in the future. But in psychology, in psychosocial nursing, we are always pointing this. No, we have to concentrate on the present. But of course, it's easier said than done, because we do not actually hold our future. We do not actually control what is happening tomorrow, what is happening in the near future. What we can control is our reaction to what's happening in the future. That's the reason why I'm telling you, as psychosocial nurses, in the practice of psychology, also, we are telling you, try always to concentrate on the present, what you can actually do. Forget about the fear and anxiety that you would actually encounter, because these are future events. But sometimes people will not listen to us, no? Now, words such as worry, concern, fear, and uncertainty are often associated with anxiety, no? Actually, worry is similar to anxiety. Concern is a reaction. Fear is a reaction. These are all negative emotions that would always be produced when you encounter anxiety. Now, anxiety can also be can also have a positive meaning. Why? Because it will help us to prepare, to be ready to face the challenge or perform some skill. No, that's why we are actually telling ourselves, no matter what the result is, it's okay. I'm still alive. Something like that, no? So we keep on always doing that, because anxiety will always breed readiness. It will help you prepare for the thing that we think like an impending doom, no? That is the thing. So we move forward. These are the different levels of anxiety, as I was mentioning to you a while ago. Now, for the levels, we have four: mild, moderate, severe, and panic attack. Now, mild is happening to all of us every single day, every single second of the day. You see, we worry. We are having anxiety attack every day. You know, I experience like you're already in your car, then you are thinking that you could have forgotten in locking the door, or you could have forgotten in turning off the stove or the light or anything for that matter in your room, or you're worrying or anxious about becoming late or being late. You are anxious about being caught in a traffic. There are so many things that are coming into our mind, but at the end of the day, we will survive. At the end of the day, we're able to approach and we're able to overcome the mild anxiety that we have. No, so the different level of neurosis that we have, particularly mild, will always be encountered by a single person, by every single human beings on earth. Not only human beings, but animals also. But animals react differently. For human beings, we react rationally most of the time. Now, what do we have here? In mild anxiety, we have the enhanced ability to deal with stressors, because the stressors that we may actually have would be negligible, could easily be solved, could easily be overcome. Another one, heightened awareness. So you're ready, you're prepared, you're ready to solve problems. Because your problem solving abilities could always be activated, and there is always increased attention to details, because you're afraid that somebody may criticize your work, so you are going to look and focus into the details of your job. Another one, technology curiosity increase, so you will be focused on every single detail of what you are actually doing. You are alert because you are preparing your body to react, and of course you are very confident. And anyway, the most important thing, as I mentioned a while ago, is that if you are anxious, you could always act rationally, because you can always have logical thinking intact. That means you will be able to come out with the solution for every single problem or stressors that you may actually have. That is mild anxiety. Okay. So the next level of anxiety is a little bit higher than mild. It may require hospitalization sometimes, but most of the time it does not. No, it depends on the functionality that is actually affected. So let us try to look into moderate anxiety. There is hesitation and procrastination. No, sometimes you hesitate, sometimes you procrastinate. No, and sometimes there is a blocking or the loss of trains of thought. You cannot think clearly. No, there is also narrowing, because you are already hyper alert. You are preparing to focus only on the things that concern you. Narrowing of perceptual field. No, change in voice pitch, speech rate accelerates, as if you're very excited. So you're trying to compensate. That means you are very anxious if you're going to do it, because if you're going to talk to someone, they talk so fast. Maybe their level of anxiety could be higher than mild anxiety. No, then there will be selective inattention. You could not focus on doing what you need to do. There is always frequent change in topics, because you cannot get along. You cannot ride on the topic that your classmates or your friends would always be discussing. There is also physiological reactions, like in the case of increased respiratory rate, increased heart rate, increased muscle tension. The more tangible thing is that there will be dry mouth, there will be palpitations, no? And you could always look at that person who has moderate anxiety, because they would fidget. They would act like as if they are very restless. They cannot even sit down for a while. They just move here and there. No? They would always do some sort of purposeful activity, like in the case of pacing. You're there, just walk in the corridor, no, back and forth, or wringing of hands, and so on and so forth. Okay. Now, the next level of anxiety that we should understand would be severe. Sometimes you need hospitalization in this case, because you could not anymore control. It's very difficult to control your fear, your negative emotions, and sometimes it's very difficult to cope. So you need the help of other people to do that. Now, here, the severe anxiety would always have highly distorted perceptual and cognitive function. Your thinking is always affected. Yeah. You focus on small scattered detail because you're afraid that other people would look into your details. Inability to see connections between events because you are just focused on looking into one thing and the one that actually caused you dysfunctionality. Selective inattention, you will not always look into the whole details, but you focus on one thing that does not matter to other people, but that matters to you a lot. No, and your inability to concentrate, you cannot focus on doing your job one at a time. All right, then moving on, there is a fear. You would always be all of a sudden fear of losing control. No, purposeless activity, like as mentioned, you may actually have pacing and wringing hands. You have difficulty verbalizations. It's difficult for you to speak. No, inability to learn, and sometimes it will be very difficult to learn. There is always this is the thing that lead into dysfunctionality, sense of impending doom, so that tomorrow you keep on thinking that nothing will happen to you, or tomorrow all the worst will actually come to you. There would always be physiological reaction like sweating of your hands, you hyperventilate, there is tachycardia, there is frequency and urgency of tachycardia, heart rates. You could also experience nausea and vomiting. You could also experience numbness or tingling sensations. No, then you could always have dilated pupils when you are going to check your eyes. No, severe anxiety needs hospitalization because we need to control this irrational fear that we may encounter, our dysfunctionality, and among others. All right. Really, if you have this, we would like to maintain the functionality of the patient. So we have to help. How do we help? By doing psychotherapy. If you're not trained to do psychotherapy, then it will be very difficult. No, the least that you could actually do is to give medicine that is prescribed by the psychiatrist. So if you have severe anxiety, then you need to see a psychiatrist or you go to the hospital. The fourth level is panic. No, panic. There is immediate biological, physiological response because what transpired, what happened in a split second, happened at the current time. So what do we have here? Mm. You may encounter dyspnea, choking feeling like you could not breathe, and chest pain. Yeah. Then you could have extreme discomfort. Yeah. See, you could have emotional pain. Sometimes you may have unrealistic, distorted perceptions of the situations that you may be in. There would always be disruption of visual field, no, distortion and enlargement of detail. You magnify everything. You know, you magnify the small things that transpire to you that happen to you. You have the inability to speak because you are becoming dysfunctional. You are becoming unintelligible. Communication is incoherent. No, and then you feel that your personality is disintegrating. Sometimes you feel that you're losing your mind. Sometimes you fear of death. You're afraid of death because you fear of dying. Okay, so sometimes you think about that. No, so panic happens all of a sudden, abruptly. It's acute. It comes. You see, all of a sudden without you understanding it because you could have encountered a trigger. What could be the trigger? That's something that's unexpected, like when you are standing along the street and all of a sudden there is a speeding car coming towards you, and that speeding car just miss you for about 1 or 2 seconds, or that one miss you by around 1 or 2 inches. So of course you could not move. That would be your immediate reaction. And after that, your physiological response would always come out. And then, of course, you need to deal with that. But most of the time, if you are in panic, you cannot deal with it. So medicines would always be given, like in the case of Ritalin, among others. Right. So let us try to look into the different theories that would have caused anxiety to our patients. No, we have number one, biological perspective. It has something to do with our chemicals, with the chemicals that control everything in our brain. We call it neurotransmitters. No, and other resultant anatomical and physiological structures that could actually have been in our body for a while. Now, anxiety is the uneasy feeling aroused by a threat or danger and is accompanied by a physiological response. Take note of that. There would always be a physiological response, increase in blood pressure, increase in your cardiac rate, pulse rate, your sweating, and so on. Now, this response prepares the person for applied or fight. No, if you're going to recall your lesson in stress, um, one very important psychologist actually proposed a theory, the flight or fight theory, Hans Selye, right? So he suggested about that. Now, here the flight response would always be um, coming from or would be carried out by sympathetic stimulation that could have caused changes primarily in the cardiovascular and neuroendocrine systems in the body. And on the other hand, the flight response is parasympathetic. No, there is already perception of the things that are happening. So that means you could actually have thought that that thing would always give you danger. No, all right. These occur in an acute fear states, an effort that is made to conserve your body responses or resources. A resource on metabolism or monoamines and the function of the limbic system are central to the expression of the emotions such as anxiety. This is a pathway that we are always following every single day. The pathway that crosses and crisscross, and at the end of the day, the impulse is actually transferred or it's already detected in your, I transform into chemical impulses that could always be carried by the nerves. No, so the discovery of the benefits of benzodiazepines, we use this for anxiolytics, no, for chronic anxiety and studies on sodium lactate in persons with panic attacks. Sodium lactate would always be given also, right? Now there is another perspective that we have to look in looking and understanding anxiety. That is psychoanalytical theory or perspective. As I mentioned to you earlier, we are made up of three structures of our personality. There is on the theory of Sigmund Freud. Now, the anxiety here will represent a person's struggle with the demands and prohibitions. The demands will be coming from your id, prohibitions will be coming from your superego because superego serves as your conscience. No? So take note. See? Then anxiety is a signal from the ego that an unacceptable drive is pressing for conscious discharge, right? Then there is also a conflict that would result between the drive, that is the id, usually of a sexual or aggressive nature, and fear of punishment that disapproval. Because once that the id comes in, because id always is catering to our animalistic desire. Human as we are also animals. We do things if we do not check. Now we do things, but our super ego, which is the conscience, would always counteract what your id would actually ask you to do. So that's why the ego is always in conflict. The ego is always in trouble. The ego is problematic on who to follow. Other people would say follow your heart. Other people would say follow your head. Hmm. That is actually the thing. If you are going to follow your head, that means to say you need to rationalize, you need to consider all the things that you would actually that could have affected you already. So id and superego are always working together. So in the end, they will reduce or they will produce anxiety. That would be the resultant behavior that you could feel and you could actually observe among people with anxiety disorder. The next one would be your interpersonal theories, the way we relate with other people. Now, here, the interpersonal theories would always believe that anxiety arises from experiences in your relationship with significant others. Now, losing them may actually bring us significant anxiety. Or the experiences that we could actually have with actually, when we were children, would always bring us to a better person that we could actually be. Now, looking into some experiences of people or children, if a child is treated malevolently, very good, no? The foundation is laid for the child to become insecure and feel inferior and anxious in future situations. See, if they're very protective also. The child is forced to use coping strategies to allay anxiety. This will become part of the personality when the child becomes an adult. Very important because by all means, we will not be shielding our time all the time, our children all the time. We could always experience something. So it's very important, no, that we have actually to do that, no. So that is the meaning of impersonal, interpersonal fear. Just like our relationship with our parents, sometimes we would like to please them, so we follow them. But if you thought that you could not have followed them, then you would always be anxious already. If you have forgotten something at home, you would be anxious already while you are in the car because you're afraid to tell your mother that you have forgotten a very important material at home, among others. That is the usual example that I give to the students. Now, another very important theory that will use in order to look at anxiety, patient with anxieties, the so-called learning and behavioral theories. In learning theory, we really would like to emphasize that bad attitudes, bad perceptions of anxiety or any anxiety provoking event may give you into limelight, into the negative limelight. So you do not need to learn everything, but as necessary, we have to learn it, no? Especially in the United Arab Emirates. Now here, it will explain the anxiety as the result of a conditioning process in which a neutral stimulus has come to represent the punishment pain or fear. Now, the individual learns to reduce anxiety by avoiding a negative stimulus or by approaching a positive person. Most of the time, they will seek out people. Now, if you think that you are in trouble, if you think that you need to talk to someone, because the more time that you're going to wait for someone to come to you, it will be too late. You cannot control anymore your anxiety. So chances are, if you know, then either you will join the group or you invite the group into your place. That's how it works. No? All right. Moving forward. So these are some of the sources of anxiety that we may actually have. So let us try to look into the sources of anxiety, right? Threats to biological integrity. Now, as you will know, our human body is always working because everything is in the state of equilibrium. Every single part do have biologic integrity. That means to say, integrity means it functions what it's supposed to do. All right, it does what it's supposed to do. It performs, in short. It will not break down. The moment it will break down, then you will be brought to the hospital as such. As simple as that, no? Now, actual or impending interference with basic human needs such as food, drink, or shelter, warmth, safety, and like for instance, when you're at home and there is no food, you're going to worry about it. Because if you are not going to prepare food, you will not eat. If you will not eat, you're going to be starving. If you are going to starve, you're going to die. That is essentially the meaning of threats to biological integrity, threats to sexual security, self-security, or self-esteem. That will include unmet expectations important to self-integrity. Like you think that you did very well in the examination, but when the result comes in, your integrity could be affected because you could always see the result as zero or something like 6 or 5. You are not happy, definitely. But this would be the reaction that you will actually have. You are destroying yourselves in that case. Because family members, including the parents, would not always give a tap in the back, just in case the children would have performed very well. Unmet needs for status and prestige, no? So everybody would like to be recognized, including me. I need to be recognized. I want to be recognized. Other people too. What if no one recognizes you? So you would always say, what did I do wrong? What did I do to deserve this? See, you have to look for answers, definitely. Anticipated disapproval by superiors or inability to gain or reinforce self-respect or to gain recognition from others. See, as I mentioned earlier, a severe, sudden, unexpected threat to sense of security, self-esteem, or well-being. And next one is guilt or discrepancies between self-protection and actual behavior. Like for instance, you could have helped the child to survive if you could have known how to do CPR, just in case they could have encountered heart attack. That's the thing. When you're at your house, you would be thinking about what could have done, what could have been done. That is the meaning of this. All right. The next one is that let's say we have your trust, self-esteem, security, and so on and so forth. Now, these are the things in which we actually need to preserve our integrity. These are coping mechanisms and defense mechanisms that we would be using once in a while, like in the case of acting out. No, a converting anxiety into anger. You're anxious, then you can actually become easily irritated and angry, which is either overtly or covertly expressed. Paralysis or retreating, withdrawing or being immobilized by anxiety. Let's say you did not do something, you did not do good in your university, you really would like to withdraw because you do not want to see other people. There are moments like this that we do not want to see other people. We do not even want to see our colleagues, our children, just because of the paralysis or retreating. Somatizing is another defense mechanisms that we could actually access and use. Now here, there is the conversion of anxiety into physical symptoms such as stomach ache or headache without us knowing it. Like for instance, today you could actually have a lot of backache, no? Because you would be thinking about the examinations that you would undergo. You under no circumstances that you would have known what would be asked. So you would think the worst or you would think the best. But anyway, the person that I give you as an example was arrested recently just because of that. Okay, avoidance is another thing. Evasive behaviors performed unconsciously to ward off or relieve anxiety before it is directly experienced, like in the case of alcohol, sleeping, or keeping busy. No, evasive behaviors. If you're going to apply this in your lives, also, let's say you are anxious every time your superiors would actually have, um, let's say, your boss could have been causing some sort of problems. No? Yeah, so you could not do good, so you certainly are afraid. You are certainly are afraid to face. So whenever you are going to meet him in a hall, you try to move away. That is actually the meaning of avoidance, right? So that's the thing. Another one, of course, that what we can do as people, no? So these are some of the behavior patterns that's used to cope with anxiety. What can we do as people? What can we do as nurses in order to help our patients to overcome anxiety? We have what we call as constructive action. No, what do we do with that? No, using anxiety to learn and problem solve. So anxiety comes all the time. Anxiety is there all the time. We use it in order to solve our problem. Like in the case of, it will teach us to set goal. It will teach us to learn new skills, because we need to cope by all means. If some of the things, our lack of knowledge or something, or lack of skills, could lead us to worry so much, then we have to learn something about it, or we need to seek information. So that's the thing. Just like what's actually happening right now, COVID-19. Everybody is anxious about COVID-19. Everybody is anxious about the situation. What would they do? See? So they are actually looking into answers to the question. They read about they read about COVID-19. They read about different vitamins that could actually have increased our immune system, or they could actually have read something about vaccination. We're doing that. So in that case, we're actually doing constructive actions in any way. No. Now, syndromes of abnormal anxiety will be frequently observed in patients that include in the following: panic attacks. As I mentioned to you earlier, panic attack is always coming at a spur of a moment, acute, current. There is always an intense attack of anxiety associated with extreme changes in physical and emotional behavior, and can last for minutes to hours. Just like you have encountered an accident, or you are putting yourself in an accident. You hit someone while you are driving. You see? So something like you're immobilized, no? In any way, you could not actually react because you are in panic attack already. The physiological responses are always there, no? You see, if you are going to have a panic attack, this could be characterized by sudden, intense, and discrete periods of anxiety and fear that may occur without warning in previously calm and untroubled individuals. Because the situation comes all of a sudden. You are not ready, you are not prepared. That's why you are in panic. I will give you an example that's commonly encountered by us. Let's say all of a sudden your friends come to your house. You have nothing at home. You have not done your grocery. You have nothing in the fridge to cook. All of a sudden they came. So what would you feel? You would be in panic, no? You would not know actually what to do. Or let's say you forgot something, just like Wafa this afternoon, no? When she was late in taking the examination. Wafa, did you have encounter panic attack this afternoon? You could have attended 3 o'clock. You see, you thought that the examination would be 3:15, 3:15, right? Wafa, you're there? Can you hear me?
Yes, doctor, we can hear you. Maybe
Yeah.
she's busy.
You see, Wapa was late a while ago, right?
Yeah.
When she was late, she thought the examination would have started at around 3:15. It was already 3:15. It was already past 3, and yet she had not started. Before she knows it, she was called by the teacher. What do you think could have been done by by Wafa? She could have been in panic attack, panic mode, right?
Yeah.
Anybody can actually, anybody may experience this. This is acute. This actually happens all of a sudden. Sometimes we could not react, you see. But of course, and anyway, our body will try to stabilize that, right? So moving forward, we have also post-traumatic stress disorders. This is another very normal event that's actually going on, that's happening to us, no? When we encounter something that's very traumatic, that's actually unthinkable, no? In that case, all of the events that could have been experienced before are coming all over again. That is, you re-experience your trauma from a previous traumatic event. Just like what I mentioned to you a while ago. When you are a soldier, let's say for example, you are a soldier and you are in war, or you participate in a war. What happens is that Of course, when you are not ready, when you come back for a vacation, you would always associate something like the sound of a gun to something that's actually being killed, no? And so on and so forth. So you are re-experience the trauma that you could have experienced beforehand. You could actually witness rape, or you were raped, assault, or you could actually be a victim of assault. You could actually be in flooding. You could actually encounter the earthquake. You're lucky here because we do not have earthquake in United Arab Emirates. Or you may actually have been involved in major car accident, you know, or airplane crash, or bombing, or torture, among others. You see, once in a while, when you experience all this life-threatening events that could have actually happened to you, you may experience the reaction because you could not have immediately reacted. So it remains there unsolved. It remains there in your psyche. It remains there in the unconscious for a while, and sometimes it actually threatens your integrity, gives you inaction. No, so let us try to look at the different level of PTSD. Acute. Now, in acute PTSD, the symptoms will begin within 6 months of the event and do not last longer than 6 months. That's why if you're going to look at our military, everybody knows that our military are participating or are helping in in the war of in Yemen, no? Because we wanted to stabilize the politics and the government of Yemen, so the government sent some delegates coming from United Arab Emirates, and most of the soldiers are coming from Ras Al Khaimah. You see, so you know, I think 2 years, 3 years ago, did you witness that? No, 3 years ago, lots of our martyrs were killed in in Yemen, right? That's why we celebrate Martyrs Day also, just because of that. No, you see, these people, our military could actually have been there for a while. They could have witnessed some people killed. They could have witnessed some bombing. Some are there. So of course, everything would always be considered as a part of becoming a soldier. When they come back for a vacation, for a while they would be normal. But as time passed by, within a period of 6 months, the experience that they could have witnessed in Yemen would always come back to haunt them. They would always you know, be afraid when they would hear something like sound of a gun, sound of a plane, shouting, among others. No, it comes. So the most difficult thing is that you relieve the situation that you could have been there, that you could have been few months back. Chronic, this is more difficult because if you're going to look at some of the war veterans in United States, this is usually the problem that we have in the United States, the war veterans, no? Especially if you have been deployed in different wars in the Middle East. People are really injured psychologically, no? Because the symptoms are always coming and going after treatment. They could have killed people there, so it comes. Or they could have been a party of bomb victims. So after few months, it comes. Treated, it comes again. Treated, it comes again. That is usually the problem. So that's why they would be distracted to their family members. So they would always select to live in the community in the street. So if you're going to go to the United States, you will see some street dwellers, and you will be surprised to know that these street dwellers were former soldiers. Just because of this, they cannot maintain a family anymore because it's traumatic. No, then delayed symptoms begin after latency period of 6 months or more. Sometimes you think that you're normal, you think that you've been discharged in the military, but after some time, it will actually the experience of fear would always come to you. Maybe it comes in a year or 2 years, but the certainty is that it will come to haunt you. So the bottom line is this: no, as an individual, if you're going to look into the experiences of people with PTSD, you'd always think that it will hold them all throughout their life, not unless it will be treated. Okay, moving forward. So we have here phobia also. Phobia is an intense, irrational fear response to a specific external object or situation. Something like you're afraid of an animal is a phobia. It's irrational fear. You are afraid of a spider. You are afraid of a cockroach. You see, in fact, so many of these phobias have been made into movie like arachnophobia, fear of the spider. If you're going to think of it, no, spider cannot kill you. But why is it that people are afraid of spiders? If you are afraid of cockroach, a cockroach will not kill you. But why is it that people become or are afraid of cockroaches, among others? You see, so there is an irrational fear. There is also OCD, as I mentioned earlier. No, this is a paralyzing anxiety disorder associated with repetitive compulsive thoughts like obsessions. Right now, a lot of people are actually into that, no? Especially they are obsessed in washing their hands so many times a day. And of course, your behavior is compulsion, touching a specific number of times a specific object or arranging specific things on the table, on your table perfectly. All right, something like that. No, so that's the meaning. If you are not going to do that, then certainly it will bring anxiety to you. So it becomes a disorder. We call it obsessive compulsive disorder. The basic example that I can actually give you is the cartoon movie Mr. Bean. If you're going to look at Mr. Bean, see, his behavior would always tell that he has an OCD. He would always lock the door how many times? He would always touch something how many times? Yeah, that's compulsion. Yeah, obsessions that you would wash or do things so many times at that. No, that is obsession. Repetitive actions. All right. These are some of the related clinical concerns that we would always consider in if we would like to consider anxiety as such. No, we have here anxiety is the most common complaint in medical practice that we actually have. The moment the patient is accepted or admitted in the hospital, then the patient may experience anxiety already because they do not know what's going to happen to them. They are separated from their family. Their cycle, everyday routine is already affected. That is actually that's related to this, no? And then it presents in many ways and with great variation in intensity and duration thereon. Treatment must be individualized and monitored very closely. As such, if you are a health professional, if you're a nurse, or if you're a psychologist, you could always actually help the patient by having one-on-one relationship with them. Treatment must be individual according to how and what we understand about the patient, because sometimes the cause of anxiety could have something to do with their personal experiences, especially in the case of irrational fear, in the case of phobias. No? Now, anxiety may be caused by many other medical and psychiatric problems, such as cardiac and vascular disorders. So, if you have the disorder, definitely you could actually encounter some sort of anxiety because you may not know. Fear of death is that all the time. At the end of the day, maybe you could already feel something, you know. You could actually be afraid that everything that's happening to you could be associated with your disease. Maybe you may actually have sleep disorders. Hyperthyroidism may always bring you some sort of problems. See, unexplained anger about your behavioral problems, anemia, depression with agitation. You could actually kill, no? If you are agitated, it's just like mania, but it's opposite of mania. Dementia, forgetfulness, and personality disorders, no? Some medications like caffeine intoxication and withdrawal from alcohol or sedatives may also cause anxiety. No, anxiety can also contribute to medical illness such as arrhythmias and labile hypertension. Anxiety is real. Now, what are we going to do as nurses? In psychosocial nursing, this is the thing that we have to address. What are we going to do? We have something to offer. Now, even though we are not trained as psychosocial nurse, we have at least this understanding that if a patient is afraid, we have to help them. See, much more. We are right now understanding about psychosocial nursing, so we could always offer help. Because you see, the moment that you understand the disease of your patient, you can easily treat them. You understand anxiety, you can easily treat them. You understand the cause of the anxiety of your patient, you could always help your patient. So understanding your patient will actually be the key. Just like understanding ourselves. We could also solve our problems if we understand ourselves the problem. That's the only way it should be. All right? Any questions so far? I'm going to stop here because I believe you are tired. And then I feel so hot also here. It looks like our aircon is actually turned off. No, it does not feel good. Anyway, so is there any questions so far?
No, no, doctor.
By the way, as I repeat now, you have already seen how Iklaba is, no?
Yeah, yeah.
Very easy, right? The thing is, for 10 items, you're going to have 15 minutes. So you're going to work with that.
But
I
it's necessary to open camera, doctor?
Yeah, because we will actually need to see you. You know why?
Not to cheat?
uh,
We are not cheating.
cheating, just like watching Umburyo. That's the thing, because moving your eyes. So this is,
No, okay.
yeah, this is the thing. Because other people would actually have notebooks in front of them. It says,
Yeah.
if there is no camera, how do we know? That's the thing. That's the explanation of it. No?
Yeah,
Uh,
inshallah.
you reviewed the I think I gave you spiritual distress, right?
Yes.
So you reviewed the first 10 pages only because I believe that's around 19 pages, isn't it? The
Yeah,
first
too much.
the first 10 pages only because I do not want that you're going to suffer so much, Anyway, I really would like to assist you and help you also in whatever I can to help you prepare to join us by next semester for your master's degree. Okay, so if there are no
Inshallah.
questions, then we call it a day already today. I feel so hot actually here.
Thank
Yeah,
you,
so we call it a day today. Thank you so much and have a good day.
doctor.